Hi, everyone. Assalamu alaikum. Thank you for having me here. It's a pleasure to be here. I'm Loubna Bouarfa. I'm a scientist, an AI scientist turned entrepreneur. Started my career in building artificial intelligence in the operating theater. And after academia, I started a company to build AI brains for life science companies. So today, I'm going to share with you a glimpse of how AI is shaping the healthcare of tomorrow. And we've heard a lot. We've heard how AI is saving the planet, the inflection point we're going through. Now we're going to see that from a point of healthcare. I was born in 1983. The world population back then was 4.6 billion people. My parents were born in mid-50s. The population was 2.4 billion. In one generation, the population on this beautiful planet is doubling. We are getting to 10 billion people by 2050. And we have bigger goals, bigger ambition for our planet. From a healthcare perspective, how are we going to keep 10 billion people healthy? But most importantly, how can we prevent them from getting sick in the first place? So where are we now in healthcare? Our healthcare system is based on one-size-fits-all model, which means we assume that one treatment will work for the majority of us. And this model has proved in many occasions that it's not working. So we transitioned to stratified medicine, that medicines can work for different types of group of people. But again, we realized, actually, diseases are not targeting organs. They're targeting more than that. They are related to our environment, to our DNA, and instead of seeing us as a set of organs, we need medicine to see us as holistic human beings, but more importantly, as unique human beings. And this is not new. This is not something we started thinking about once we got AI. This is something we started thinking about in 1840, when the cholera pandemic hit in Europe. Social movements in France and the UK realized in order to save humanity from the epidemic, they had to analyze data around samples of water, environments, to move to what they called, back then, probabilistic medicine. Can you imagine? In 1840, they were talking about probabilistic medicine. Unfortunately, this movement failed because of the leading figures that failed, and we moved to a bureaucratic view of medicine. We divided the body into organs, and we defined specialism that treats each organ separately. And that's sad. But now we have the tools. We have a technology that can allow us to analyze data in a holistic way, to predict outcome, and to move what is on the right side here, precision medicine. But what is the reason of this one-size-fits-all model? What is the reason of that? Why did we all went in a tunnel vision, thinking, can we solve the problems of healthcare with one model? You will be surprised to hear that the main reason behind this model is a beautiful mathematical theorem called the central limit theorem. If you pick random samples of a population in a random way, and they are unbiased, a sufficient big sample will allow you to fit a nice bell curve distribution and generalize the results on everyone. It sounds amazing. It's a mathematical formula that solves everything. But the main conditions, the samples need to be uncorrelated, unbiased, and that is impossible in healthcare. We are all living in the same area, the pollution, the food we eat, and not only that, our body is connected. Our organs are not uncorrelated, which means when we validate a treatment in a clinical trial, as this is the gold standard, when we fit this nice bell curve, it only works for the average population. And most likely, people like you and me, the majority in this room, will be in the tiles of this distribution that go to infinity. Which means the most likely scenario, standard treatment won't work for us. So how can we change that? The time is now. We just survived a big pandemic. Let's look back to 1800. Let's use this occasion right now, coming out, breaking the 10 years of clinical trials into 10 months to change the way we do things, to move from waiting for people to get sick, from sick care to proper healthcare. We are at this inflection point. We either go the wrong way and just keep doing what we're doing, or we use this occasion to change. We see AI is already here. We can use it. We see if we empower our healthcare system with data, that we can create these data-driven healthcare systems. We see business model can change. It's no longer about the volume. We should not be paying for the pill. We should be paying for people to get better. And we see that data ownership is the path to value creation. When we live in a society where healthcare system is data-driven, I cannot opt out because I'm responsible. My data will save other people's life. So how can we create that? The other big thing that we should realize, and we heard about it this morning, AI in healthcare does not need to pass the Turing test. The Turing test is when you have a man and a machine and one needs to beat the other. This is not the scenario. We need to treat AI like engineering. When we designed airplanes, we didn't design airplanes that fly like a bird. We designed airplanes that respect the aerodynamics law, that can be efficient, effective, and safe. Therefore, the applications of AI in healthcare needs to be taking all the mundane tasks, need to be freeing up doctors' time to focus on the serious cases, patient triage, prescription, risk, prediction of diseases. I'm dreaming of a future I don't have to worry for my children to get sick. I dream of a future that the healthcare system takes care of the health of my kids. Systems that predict the risk for diseases, automatic reminders for tests, and prevention is working. When a person is born, from day one, we can predict all the risks, we can prevent, we don't wait for people to get sick. That is the future for healthcare, and it is possible with the technologies of today. Treating healthcare like engineering is what we do at Okra AI. We're building AI pipelines, systems that self-learn and autonomously update itself. Treating healthcare like engineering is about building like we build the roads and the bridges. We need to build the right pipelines for our AI to self-learn. A nice methodology to be published, that's not AI, that's statistics. AI system needs to have a high autonomy to self-learn, like self-driving cars, like others, but that's also in healthcare. That's systems that do triage, that do prediction, and that's what we need to drive. We are, unfortunately, still on the first layer, if you look to our healthcare system. Knowledge is transferred from human to human. We are climbing to get to the second layer, but where we need to be is in the third layer, when we have human agents and machine agents, when we have humans and machines working together, hand in hand, where your memory as patients from the day you were born is used to make prediction what is the right treatment for you, when your data is leveraged to save other patients' life. That is what we need to be aiming for. And I know many of you, whether in governments, whether in the public or private sector, you're thinking, how can I contribute? What can I do? As an entrepreneur, I know it's hard. It's hard because from the one side you want to innovate, but from the other side you've got to be efficient on the budget, you've got to maintain the legacy. But we are responsible for this. We need to think and start small. We need to aim for improving speed of the way we work, to put the citizen in the center, the user in the center, to aim for high quality and scalability, because even the best AI, if we cannot scale it, it won't add value for everyone. And last but not least, we need to make AI explainable, because if we don't explain it, people won't use it. So Thank you very much. This is my talk, and I hope you learned something today.